Parkinson's disease affects many different systems of human body and many different aspects of human life. Being affected with Parkinson's disease, you will face challenges in controlling the symptoms of Parkinson's disease and improving your quality of life. In order to best achieve this goal, you will need to keep communication lines open with each member of your healthcare team. You can help your healthcare team provide better care to you. Ask questions to your healthcare team about aspects of Parkinson's disease you are unsure of and write down their responses so that you can refer to them later if needed. Also maintain a list of your medications and make sure that each member of the healthcare team is aware of them. Make sure that any new developments are passed on to all members of healthcare team so that they are kept updated about your condition. Your family physician will recognize the signs of Parkinson's disease first and refer you to a neurologist. A neurologist is a specialist in Parkinson's disease who will do the final assessment of your diagnosis and will make a treatment plan for your specific needs. As the disease progresses, this plan may need to be altered to provide the best possible care to you. You should see your neurologist 2 to 3 times a year for follow-up visits. If available, you should see a neurologist who subspecializes in Parkinson's disease and movement disorders. The physiotherapist will advise you about different exercises, helping in balance training and teaching strategies to prevent falls in order to improve your mobility and posture. The occupational therapist will advise you about the strategies to help you carry out your day-to-day activities to make sure that you lead a productive and satisfying life. The methods used to achieve these goals may be different from person to person. They may also advise you to alter your environment in order to make it safe and easier for you to carry out your daily tasks. Parkinson's disease may cause problems with speech and swallowing. The speech pathologist will suggest you exercises and strategies to help these problems. The pharmacist will counsel you at the pharmacy about your medication, and by visiting the same pharmacy consistently, you will ensure an accurate record of your medications you have used. Also, the pharmacist will make sure that any other medications you take don't interfere with your treatment plan. A healthy diet and weight is important for good health. Certain foods, such as high-protein diets, can interfere with your drug absorption, and the dietitian will advise you how to plan your meals and avoid this problem. Social worker will provide guidance towards any financial and family concerns you may have. He or she will give you advice to deal with the changes in your lifestyle and living situation. Social worker may also aid you in finding a financial assistance program. Symptoms of depression, anxiety, and hallucination can occur in Parkinson's disease. The psychiatrist will advise you how to manage these problems. Urinary bladder and sexual dysfunction may occur in Parkinson's disease, and a urologist who is a specialist in this area will assess and treat you for these problems. You should also consult a specialist in financial planning. Make sure that your medical coverage for your medications is active. An accountant may help you to make a plan for most of your tax deductions. You should also write a will and assign somebody the power of attorney, as at some time you may not be able to communicate your desires concerning your finances, medical and personal care due to your condition. Therefore, it will be useful to plan for this as a precaution in advance.